So migraine is genetic and it can come at any age. So we have people who didn't have migraine all their lives, and at age 65, suddenly they're getting a migraine and then they join. And we have people who start young. They have people who lose it when they enter into menopause. We have men who come in. Some of them lose it, some of them gain it. I mean, it really is an epigenetic factor of when migraine will actually be activated by the factors that surround you or whatever factors you create for yourself with your lifestyle. It can happen anytime. So there's nothing surprising about having younger generations diagnosed. I was 10, 11, something like that, and I had my first migraine, but I was not diagnosed because they didn't realize that the symptoms that I had were migraine symptoms, only I had an atypical presentation. At that time, it was atypical. Today, I understand that most of the children present with the kind of migraine that I had. It's just we didn't know it was migraine.
Until I read your book, hadn't realized how complex migraines were. I completely had no idea that there were different types of migraines and that the symptoms could be so very different from people to people. But also, I think there's so much of an overlap with other conditions that it's not always easy to diagnose it correctly. And I think you cover that in the book. You say there's so much misdiagnosis of migraines. So what's the problem there? What's happening?
Okay, so there are many things that are happening. And so your question is very well taken, because we think that when you have a disease or a condition, which comes with very specific symptoms, then you should be able to identify what it is. But the problem is that, take, for example, aura. We associate aura with migraine, right? But if you have a seizure, if you get a stroke, if you hit your head really badly and end up with a concussion, any kind of traumatic brain injury, they all can come with aura. So having an aura doesn't mean that you have a migraine. And they have many people who had an aura and they were diagnosed, therefore, as migraine, but they don't have migraine. And it may just have been a situation that could very well have been completely random, and they ended up with an aura for whatever reason. Could even have been a head cold for all we know. It's just a disturbance neurologically that may cause that. And similarly, many of the symptoms that you mentioned, that in fact migraine is a lot more than just a headache, which is what everybody think about. In fact, you don't even need to have a headache to have a migraine. And over 20% of the population, of migraine population, don't even have a headache with their migraine. So a headache itself doesn't represent a migraine. It may or may not be part of it, but you have a host of other symptoms. It could be nausea. Vomiting is very common. I mean, nearly everybody will vomit. I mean, how often do you vomit from a simple headache? You don't. So clearly it is something else. Many people will be dizzy. They will be very sensitive to light, sound, taste, touch, odors. I mean, that's going to be extremely sensitizing. They will perhaps be irritable. They will have extreme urination right before migraine. That's a prodrome that they will be urinating quite a bit. So we have a host of symptoms that are not associated with a headache that is still part of migraine. So when they're diagnosed migraine, they need to look at all these symptoms, but all these symptoms like irritable bowel syndrome, IBS, for example, or restless leg syndrome, RLS, these are all symptoms of other diseases as well, just like nausea is, just like vomiting is, diarrhea is. And so when you're looking at all these symptoms individually, they all fall into different individual categories that can be part of other conditions as well. So unless you have a doctor who understands the whole picture, they won't be able to diagnose this migraine, particularly if you don't have the headache type form. And so we barely have any members in the group who don't get a headache with their migraine, because they tend to be dismissed as something else.
Yeah, that's interesting. So let's ask the question, is migraine a disease then?
No. If you can prevent it and if you can treat it without medications, then what are the chances that it's a disease?